We should not actually be able to medicalize Ebola. Ebola and COVID-19 and Marburg, all those are public health interventions which should be actually be approached from a public health point of view. And as Public Health Union, I want to say this. And PHOs, we are trained on outbreak containment. And part of the measures to contain an outbreak is establishment of quarantine centers. And we are not saying only one in Laikipia. We need to have quarantine centers all over this country, because this country, we cannot afford to expose the Kenyans to Ebola. And we need to begin with the high-risk areas. And we want to thank, I know there has been a lot of debate about the quarantine in Laikipia, but I want to say this, that we cannot afford to allow, because people walk in through our borders. We need to enhance border surveillance, because the border surveillance, we must be able to continue to do screening. We need to continue doing screening, and we're talking about screening all the protocols in regard to international health regulations. 205 must be adhered to. And therefore, we also need to do, we have also agreed that commodity and logistics in terms of PPEs, and the governor has assured us that they have actually provided all the protective equipment to all the healthcare providers who are actually working at our borders and also within our areas. We want to also ask Honorable Duale to fast track mambo ya PNP. Sema PNP. PNP means permanent and pensionable terms for universal health coverage officers who have been working under contract, because this is a high time to be able to make sure that we beef up security. These officers be employed so that we can be able to be given enough time to be able to discharge their mandate.